Multitasking has been traditionally perceived as a women's domain. Well, if you are one of them, juggling many priorities, adorning many hats, constantly jumping between office responsibilities, emails, running in and out of meetings, cooking a meal while looking after the children, and suddenly having to answer the phone, this episode of Health Point is for you. I'm Anahis Patel, Certified Health and Fitness Coach, and let me welcome you to Health Point, a short 5-minute show that brings you meaningful health and wellness tips from reputed doctors. Did you know how important calcium is for women's health? Low calcium levels can cause extreme fatigue, which involves a lack of energy and feeling of sluggishness. Over time, hypocalcemia can affect the brain and cause neurologic or psychological symptoms. Calcium deficiency for the long term can lead to dry skin, dry and brittle nails, coarse hair, eczema, skin inflammation, skin itchiness, and psoriasis. Today, we have with us Dr. Hrishikesh Pai, President of the Federation of Obstetric and Gynecological Societies of India, or commonly known as FOGSI. So, let's know about women's health in detail from Dr. Pai. Welcome, Dr. Pai.
Thank you for having me here for a discussion of this very critical aspect of women's health.
Is it true that women usually excel at multitasking?
Yes, recent research conducted in the UK has shown that women can outperform men in multitasking.
So does any particular nutrient have a role to play in this?
Yes, of course. In general, calcium is often referred to as the multitasking mineral because it plays a diverse and crucial role in the human body. Calcium is essential for proper brain function, blood clotting, muscle strength and contraction, maintaining a regular heart rhythm, and more.
When do women typically start worrying about calcium and bone health?
Calcium is needed at every stage of a woman's life. Women with osteoporosis are at a high risk of fractures, which can result in chronic pain, disability, loss of independence, decreased quality of life, and even a higher risk of death.
So, what would you recommend for super moms and busy women to get their daily recommended dose of calcium?
Since the body does not produce calcium, it must be obtained from dietary sources such as dairy, vegetables, and calcium-fortified food and beverages.
Dr. Pai, thank you so much for sharing your valuable insights. Now, let's see what some of the other doctors have to say about this.
During childhood and adolescence, much more bone tissue is put into the bone than withdrawn. This is the main age that sets the stage for it. In fact, preteen is the time when the girls start building their calcium reserve for healthy bones and teeth later on in life. So the skeleton or the bone account grows in both size and density. Calcium is also needed for pain-free periods. During periods, the uterus is squeezing the blood and tissues out of the body. Women experience cramps due to this. The muscles of the uterus need calcium for muscle tone and, of course, to keep the pain down.
Bones are constantly being remodeled every day, and calcium moves in and out of the bones. At birth, the body contains about 26 to 30 grams of calcium. However, this amount rises quickly after birth, reaching about 1,200 grams in women and 1,400 grams in men by adulthood. These levels remain constant in men, but they start to drop off in women as a result of increases in bone remodeling due to decreased estrogen production towards the start of menopause. In women, we have special consideration during the pregnancy period. Hypertension or high blood pressure or preeclampsia of pregnancy is a leading cause of maternal and neonatal morbidity and mortality, and this affects about 4% of pregnancies.
Calcium, the multitasking mineral, underscores its significance in overall health. It strengthens every stage of a woman's life. That's all for now. See you on another episode of Health Point. Till then, don't forget to keep it healthy.